Hey, what's going on, guys? This is Tyler, pharmacist with Pharmacy Update. In today's video, we are going to discuss the newest diabetes drug on the market, and that is Rybelsus, or semaglutide. Today I will be giving some information on this drug, including just a general overview of Rybelsus, some counseling information, side effects you may experience, and then at the end of the video I will be discussing Rybelsus and weight loss. This seems to be a popular question with diabetic medications. Can you lose weight while taking it? So I will be covering that today. So here we go. First here I want to cover some general information on Rybelsus. Like I said, it is used to treat type 2 diabetes. Along with diet and exercise, it can be used to lower blood sugar. It is taken as a once daily tablet, and it is actually the first oral tablet in this particular drug class. It contains the same generic drug that is in Ozempic, semaglutide. So instead of giving yourself a once weekly injection like you will with Ozempic, you will be taking a tablet every day. So this may be an option for a person who wants to avoid giving themselves an injection. The drug class for Rybelsus is known as the GLP-1 receptor agonists. This drug mimics a hormone that is produced naturally in your body, GLP-1. And what GLP-1 does is it stimulates your pancreas to make more insulin, but it is dependent on how much glucose is in your bloodstream. So there is a low incidence of hypoglycemia when this drug is used alone. Also, it lowers the secretion of the hormone glucagon. Glucagon increases blood glucose levels, so lowering its secretion also lowers blood sugar. This drug also delays gastric emptying, which means that it delays the passage of food or whatever is in your stomach into the lower intestine. This delay does have both pros and cons, which we will discuss a little later on. Another thing you will want to consider is that this may also cause some of the drugs you take to absorb differently. So if you are taking a narrow therapeutic drug such as warfarin or levothyroxine, this is something that you and your doctor will want to consider. Some counseling information on Rybelsus. If you are prescribed this medication, you will need to take it first thing in the morning. The manufacturer says that this drug needs to be taken at least 30 minutes before any food, beverage, or other medications. And the reasoning for this is because if you take it with food or anything else, less of the drug will be absorbed, making it less effective. So that is something to think about before you start taking Rybelsus. This may be difficult for a person that has a chaotic morning schedule, or if you have to have that cup of coffee first thing in the morning. Also, the manufacturer recommends taking this with only 4 ounces of plain water, and this tablet will need to be swallowed whole. Do not crush or chew. Next here I will cover the contraindications and warnings for Rybelsus. Rybelsus does have a black box warning, and this goes for all GLP-1 receptor agonists. This isn't special for just Rybelsus, but they have found in animal studies that giving GLP-1 agonists can cause an increased risk of developing thyroid C-cell tumors. However, it has not been proven if this increased risk also applies to humans. And that leads me into the contraindications for this drug, which basically means if you have one of these conditions, you will not want to take this. First here is a personal or family history of medullary thyroid cancer. This ties in with the black box warning. If you have any kind of history of getting these tumors, you obviously do not want to increase your risk even further by using a GLP-1 agonist. Also, any history of multiple endocrine neoplasia syndrome type 2, you will want to stay away from this drug and any GLP-1 agonist. Warnings and precautions. There have been patients that have gotten pancreatitis while taking Rybelsus and other GLP-1 agonists. This was noted in the clinical trials that the group taking Rybelsus did have a higher chance of developing this. So if you have any history of this, you may want to consider other therapies. And if you happen to get an extreme discomfort in your upper abdomen or pain in your lower back while using Rybelsus, you will want to get yourself checked out for this. Fever and higher heart rate are also possible signs that you may have pancreatitis. They also noted in the clinical trials that the group receiving Rybelsus did have more complications with diabetic retinopathy. It didn't cause patients to have diabetic retinopathy, but for these patients who already had it, they did experience more issues than the other group. However, this can happen in a person with diabetes when their blood sugar begins to drop. So they are not for sure if Rybelsus really caused this or if it was just an effect of having lower blood sugar. Side effects. So we discussed Rybelsus does cause a delay in gastric emptying, and because of that, it can have some pretty severe gastrointestinal side effects. And these side effects do occur in a large percentage of people. So this would include things like diarrhea, nausea, abdominal pain or discomfort, decreased appetite, constipation, and even vomiting in some cases. I will say, however, that these effects are normally the worst when you first start taking it. As you give yourself more doses, the body will start to get used to the drug, and these side effects should start to go away over time. Hypoglycemia is quite low when Rybelsus is used alone. However, if you start using with multiple drugs for diabetes, especially fast-acting insulin, this percentage does go up quite a bit. So if you're adding this medication to other diabetic drugs that you already take, keep a close eye on your blood sugar. And that brings me to my final topic of the day. Can you lose weight taking Rybelsus? And if so, how much weight can you expect to lose? Rybelsus currently is not FDA approved for weight reduction, so if you don't have diabetes but you need help losing weight, you will want to explore other options. However, in clinical studies, patients did lose some weight, especially with a higher dose of 14 milligrams. So Rybelsus is available in 3 different doses: 3 milligrams, 7 milligrams, and 14 milligrams. The 3 milligram dose is normally used for the first month, and then you take the 7 milligram dose after that. Then, if more glycemic control is needed, you can be increased to 14 milligrams daily. And like I said, the 14 milligram dose did seem to produce a significant weight loss for patients. The 3 milligram daily dose did not produce any significant weight loss, and the 7 milligram dose kind of had mixed results. In one of the clinical trials, the group taking Rybelsus 7 milligrams once daily lost an average of around 5 pounds after 26 weeks. So nothing too spectacular there. The 14 milligram group in that same trial lost an average of 8 pounds after 26 weeks, so that was a little better with the higher dose. And then there was another trial where the group taking 14 milligrams daily of Rybelsus lost an average of 10.34 pounds after 52 weeks, a longer time period. So if you are interested in the weight loss, you may have to try the higher dose of 14 milligrams daily, because it looks like to me that the other doses really didn't provide any significant weight loss. Well, that's all I have for today, guys. I want to thank you for watching. If you'd like to keep up on the latest pharmacy and medical updates, please subscribe to my channel. I also post drug reviews such as this one. So thank you guys again, and have a great day.